Hey guys, and welcome to the channel. My name is Cam from the PTA Assistants, and today we're going to be talking about the PTA program. So whether you're thinking about or whether you're already enrolled in school, I'm going to talk about some of the classes that you're going to be getting into and kind of just showing you my notes and kind of things to expect. So let's jump right in. So before we go into the program itself, I do want to mention that each program is a little bit different. I'm going to have a little bit of an outline of what the Carrington course program looks like, and I'm not going to be touching on every single one of them. I'm going to kind of ignore the mathematics and the communications portion and kind of jump more into what the program itself is. Since the programs are a little bit different, it doesn't really matter because the board exam itself is going to be the same. That is a national exam. So the goal for every program is the same. So even though your course outline does not look the same, just keep in mind that it's going to be rather similar to what I went through. So anatomy and physiology, if you've taken this course already in high school, you kind of already have the basics and the foundation. If you took it in college, you're going to be a little bit more prepared for the pace of it, but it's all going to be squeezed into one. But the reason why I want to bring it up is because it's going to be tailored to the PTA. And by that, for my program, is that you're going to learn a lot of the muscles, you're going to start learning a lot of the joints, the bony landmarks, and this is where you're going to start getting the foundation that you're going to carry on through the entire program and even when you get out to the field. So I would not skip these classes. I think I was able to audit and not attend these classes, but I'm glad that I did because I would have already been behind not knowing any of the muscles that I would have otherwise learned in that course. So I only wanted to quickly just touch on anatomy and physiology just because most people might already have taken this course, and the only difference was that we started learning the muscles in that class. So that's why I wanted to touch on it real quick. But now going over to the classes that are more tailored for the PTA, and the first one is a kinesiology course. So looking into my notes here, and if you have any questions on the apps that I use for these notes, I have a video already out, so be sure to check that one out. I'll leave a link in the description or in the video itself. But going through these topic notes or the headers for each class, it's a lot more specific to body parts, so shoulder, wrist, hand, gait, your vertebral column, hip, knee. I kind of just want to show you quick little headers on each of the topics because if I go through every single note that I have, it's going to be a 1-hour video and that's just way too long. So going into just quickly touching on each one. So kinesiology course, if you have a kinesiology major already or a kinesiology degree from university or college, for example, it's going to help out. But again, these classes are more geared towards PTAs rather than just a vague overview of the entire course. On this left-hand side, I have all my notes. Jumping over to fundamentals of PTA, I'll kind of backtrack to the other two next. Fundamentals is kind of the basics of being a PTA. It has a lot of just kind of the history of the PTA, the relationship between the PT and PTA, kind of some ethics and behavioral things. But kind of going over a little bit higher up here. So now we have the weight-bearing statuses. I don't know why I keep doing that. There it is. So weight-bearing statuses, special environments, challenges on ambulating, bed mobilities, transfers. And the reason why I want to bring up this course is because this is kind of where your practicals start. So if you don't know what a practical is kind of a skills demonstration while you're in the course. Everybody's going to be paired up with either a professor or another student. For my program, is with another student. And the professors are going to be kind of giving you a practice mock patient, and you're going to show them what you would do if you had this patient in real life. And this is a good way for you to get actual skills practice, and again, getting feedback on things that you should and should not do. I'm not going to lie, when we first heard that we're going to be doing a practical, all of our hearts sank a little bit. We kind of looked at each other like, we're doing what? Where? Because none of us really wanted to be on display like that, but it's part of the program. I'm sure every program does it. I don't think it was just Carrington. If you don't, then I guess you just lucked out. But again, it's a good way to practice your skills and get feedback on what to do and what not to do. So fundamentals of PTA, had a practical. Going over to documentation. Documentation is going to be a lot more of the other half of our job, essentially, and what sometimes feel like our entire job. The documentation, whether you do physical, handwritten notes, or you use an electronic medical record system, so EMR services, I use electrical. It's already broken down into SOAP, so SOAP now. That stands for Subjective, Objective, Assessment, and Plan. I have a video on that as well, so be sure to check that one out. But you're going to learn how to write a note, why it's important. A lot of it is just because of the reimbursement for insurances. We have to make sure our treatments are replicable. Like another PTA or another PT can go in, do the exact same treatment that we did and not have to question like, oh, how did you do this? How did you do that? Everything should be documented accordingly. Another thing that we learned in our documentations course was Goni measurements and manual muscle testing. So the Goni measurements, I'll kind of just go into this real quick so you can take a look. So Goni measurements, you're going to take a look. So you're going to have the position you're going to be in, where to stabilize, what the end field should feel like, range of motion, normals, where you should align the Goni. And again, this is going to be another practical. You're going to get a list of different body parts that you're going to have to measure with the Goni. And they're going to ask you, where's your fulcrum? Where's your stabilizing hand? Where's your stabilizing arm or your movement arm? And or maybe what's a normal value for shoulder flexion? And it's 180 degrees. But these are things that you're going to have to know when you're going through the program. So make sure you study on all of these, practice, whether you have a Goni, I would recommend getting a Goni. I'm sure they have one at school. And just practice on each other. You have upper extremity, lower extremity. The manual muscle testing is going to be, let me go through here real quick. So these are the length testing, and just kind of see if a certain muscle is tighter than it should be. So it's trying to isolate different ones. And if you can get to a certain point, then the muscle is considered normal length, or it's going to be a shorter length if you're not able to do it. So you have the Thomas test, we have SLR testing, Ober's, Eli's, popliteal. Feel free to pause throughout the video if you want to take a quick look at what I've written. But keep going. Okay, so manual muscle testing. So this is a quick little look at what manual muscle testing is. It's a way to judge the strength of a muscle. But this is how you grade them, and you're going to be grading all the muscles in the lower extremities, upper extremities, and the spine, the back, the trunk. There's a lot to learn, so just kind of go through all of those. I'm not going to go through all of them. I'm going to probably have a video down the road on how to study them, just kind of as a little refresher if you need to kind of help you study. All right. I was trying to avoid it, but I can't. Pathology. Pathology, I'm just going to say, is a giant dictionary that you're going to have to memorize. I'm just going to jump into a module here and just kind of go into a topic. As you can see, this one is 97 slides long. But what pathology is you're going to learn about a pathology. You're going to learn about the course of the pathology, why it happens, what happens to the body, and this is where the anatomy and everything becomes so important. And kind of the big one here is that PTA implications. So knowing what it is, why it happens, how to identify it, and then the PTA implications. There's a lot into it. And you're going to have to know that for every single pathology that you cover. And there's quite a bit. Your board exam is going to be heavily influenced on these pathologies. It's a very time-consuming course, I would say, because it requires a lot of repetitive practice, a lot of quizzing just each other, and there's just little nuances with certain ones that you have to just pick out what's the identifying factor of that pathology and just stick with it. Ortho is kind of the next step to kinesiology. So getting the knee, for example. So now we have actual conditions, more pathology-related ortho conditions, and how to kind of address them. Same thing, what it means to us. What are the protocols for an ACL tear, for example? What you should do. What are the guidelines to return to sport or return to work? Kind of the weight bearing, anything that involves an orthopedic kind of standpoint is what you're going to cover in ortho. You have here spine, shoulder, elbow, apparently some pharmaceutical, which I'm surprised was in ortho, but it is what it is. Joint lobes, gait. For gait, we were told the best way to kind of observe, or the best place to go, don't mind that chime by the way, was at an airport. Just because you have so many people coming from all over the world and you're able to just watch people walk. Because gait is not really something that you can just all of a sudden pick up. It takes a lot of actually looking for the discrepancies, watching people walk, see what happens. And I would recommend, even when you're going out into the field, if someone's analyzing gait, just kind of step in and be like, hey, are you noticing this or that? Or just ask whoever's doing the gait assessment, like, what did you notice, so that you can keep an eye out for it as well. But gait's going to be a big part of our field in general. Also has a practical, by the way. Physical agents. It's a lot of fun, but it's so tedious. So for physical agents, this is where you're going to learn kind of the ultrasound, electrical stimulation, traction. I'm really getting annoyed doing that. Electrical stimulation, like I said, soft tissue massage, and it's a way to kind of play with all the toys that physical therapy has to offer. It's just that each one is just so specific. The parameters for each one are so specific. So just make sure you kind of stay as organized as you can, so that when you kind of carry it over, or when you go through your exams, it just makes it easy. I mean, there's no way to make it really easy. Kind of just taking a quick look at e-stim parameters, for example. Here's a quick little sheet on between IFC, Russian, conventional tens. I know this looks like a lot, and it's just kind of finding the identifying factors for each one and what it's for. And yeah, so that's just e-stim, and there's several other ones that you're gonna have to know. And also has a practical. Neuro lecture. So neuro. This course is a lot of fun, especially if you plan on going to pediatrics. So you'll have a whole section dedicated to pediatrics itself. I'm kind of scrolling up. Sorry, close your eyes if this is making you dizzy. But so you have cerebral palsy. Apparently I have to go all the way down again. Cerebral palsy, muscular dystrophy. You have spina bifida. So kind of more neurological diseases you're going to have to cover in this class. So if you go to pediatrics, you're really going to love that course. You have traumatic brain injuries, cerebrovascular accidents, spinal cord injuries. It's just going to be a lot more neuro-based. You have a practical for this as well. The PNF patterns that you're going to learn in this class, that's proprioceptive neuromuscular patterns. PNF. Proprioception neuromuscular facilitation patterns. Something like that. If I find it, I'm going to leave it somewhere. But so PNF patterns, they're really useful for just anything in general, just either for strengthening, mobility, just re-education. So PNF patterns you're going to learn here, and they work wonders. I use it a lot in my practice today, actually. Ethics is just kind of right and wrong. I think I kind of mixed all these. So for ethics, it's just kind of like, what would you do if this was the case? What would you do if that's the case? Like, don't imprison anybody. Don't restrain them when you shouldn't. They should always have a way out. Just ethical things. It's just kind of like you need to know these things kind of class. Advanced concepts is more a one course or one lecture per day on a different topic, maybe for a couple days. Just kind of looking at this. So we had prosthetics, the amputation, vestibular, women's health, heart disease, aging, farm, integumentary, wound, and lymphedema. So it's just kind of broken up lectures. I don't have a dedicated course for it, but there are specialties for these things for PTAs. So it's kind of more, here's the basics, just so that you kind of know them. You're going to need to know them for your board exam, but we don't really want to dive super into it because, again, they're niches. They're very specific specialties that if you go into it, you'll learn a lot more than you will during the program. For example, vestibular. One of my rotations was at a vestibular clinic, so I learned a lot more while I was there than I did during that lecture. I can say that hands down. Last but not least, our clinical applications was kind of more study review based. So we would just look up research papers, kind of identify the good, the bad, why it's important. We also had a demonstrations course. We broke into groups, and each group had a practice patient, and we just took it from start to finish. This is near the end of the program because we took our ortho knowledge, our physical agents knowledge, our patho knowledge, our clinical rotation knowledge, and just blended it into one and demonstrated it in front of the class. So it's more of like the students are teaching the students instead of the professors, and they're just kind of there to offer feedback or advice on what's going on, which will lead me to the rotations. So rotations, our school was supposed to have a 2-week rotation, a 6-week rotation, and an 8-week rotation. When I was going to school, it was during COVID, so a lot of places were dropping their students because they weren't trying to have more people there. They were actually just trying to slim down a little bit. Luckily, I ended up going to my vestibular clinic, which was 6 weeks, and I went to an acute care, which was 8 weeks. Great experience for both. The only thing I would say about the practicals, it's great that you get kind of in-person experience and kind of actually work with patients and see the things that you've learned throughout the program. But don't entirely take it into the board exam. The board exam is going to test you on your book knowledge, not your experience in the field knowledge, if that makes sense. It's not going to be like, oh, how do you measure the big ones like range of motion, for example. So range of motion, there are specific positions you're supposed to measure range of motion. When you go out into the field, it's not always the case, because what if a patient can't lay on their back or can't lay on their stomach? You're going to have to find another way. So if you start doing that in person and then you get quizzed on it, you're going to be like, oh yeah, I did it seated, but the book is telling you it has to be supine. And those are just like the little nuances that you're going to learn while you're in the field and kind of learning in the book. So just kind of stay open-minded when you go out to the field, but when you take the board, learn it from your book or take it from your book. That was a long walk for a short drink of water, but you know what I mean. Again, a lot of these courses and my little descriptions here, they can have their own video. Kind of, that's what this channel is about. It's supposed to give you more insight, other outlets to study, and kind of other point of views, because one person might think of a good mnemonic for one thing that you never thought of. I heard about quite a few when I was already out in the field, but it's just the more you can observe from different sources, the better. Laura and I have a podcast every single week from Tuesdays and Fridays. And we also did a what to expect in PTA school video or audio, I guess, because it's a podcast. And we kind of just, same thing, we kind of broke down each class, but we spoke from both of our experiences, mine and hers. And like, we went to the same school, so they were very similar. So it might have been a little bit better if we had somebody from a different school, but still our experiences were still at least slightly different. So if you're curious about that, we'll leave a link in the description below to our podcast. Be sure to tune into that. If you have any questions on any of the courses, any more follow-ups on what to expect in the program, or if you just need help with certain topics, please feel free to reach out. We are always here to help. And our goal is the same as Lee Schools, actually. We're out here trying to get more people licensed into this field that we all love, because it is a great field. So until the next one, take care. And YouTube is telling you to watch that video. Yeah, that's a good video. You should watch that. Okay, take care.